No, I have to be super every day.
Yeah.
Even though, anyway. And it's been 15 minutes. I'm not gonna Where did you go to try?
We are live on YouTube and recording.
I was lucky. I didn't go fast.
Andre,
Yes, Keisha.
we're good to go.
Thank you. I was just making this. Okay, good evening, everybody. Welcome to the New Chelmsford Council agenda meeting for Monday, July 26th. The meeting will be held in person and by Zoom. The Zoom access, dial the cellular phone on the landline, and those located in the agenda posting. We do not have bandwidth to support a video link for members of the general public, so to participate or quote, raise your hand on your phone by pressing *9. Mute and unmute by pressing *6. To see supporting documents for this agenda, go to clickbase.com, New Shoreham, and we are also streaming live. You can watch on the YouTube channel, YouTube New Shoreham. Number one on the agenda is an update from Dr. Warkup regarding COVID-19. Is Dr. Warkup here? Dr. Warkup.
Dr. Warkup, are you here? He's currently muted and not in. He is logged in. Sorry. Yeah.
We're trying to locate Dr.
Here.
Warkup.
Yeah, here it is.
Perfect.
You want to announce it? Okay. You want to announce it?
Yeah, item number one is an update from Dr. Warkup regarding COVID-19. Dr. Ames?
Hi, everyone. Sorry for being a little bit late. Can you hear me okay?
Appreciate your time, Dr. Thank you.
So some updates compared to what we talked about last week, and the escalation is what we had expected. If you remember, we talked about 4,100 samples done last week with 14 positive Delta variants. This past week, there's been just under 3,900 variants identified, and of those, 42 are positive. So it has tripled. So we've had a tripled amount of Delta variants compared to the previous week's sample. So we went from 0.34 to a full 1.08%. Still by far and away, the biggest variant is the B.1.1.7, which is the Alpha variant, formerly known as the UK strain. But the Delta variant is certainly making higher and higher penetrance into our area. Also, we talked about with the Rhode Island DOH is that they report, say, 28 cases, new cases per 100,000 patients. And in this past 7-day trial, it's doubled. It's up to 57 cases per 100,000. So it's really starting to exponentially take off. It now puts Rhode Island in the second to highest category called substantial transmission category. So within our state, we are now the second worst transmissibility category that the departments of health put together. Over the last 2 weeks, we've seen at least 11 cases that we know of. 3 of those cases were people that were previously vaccinated. So we had 4 on one day, and then over the course of the next 7 days, we had an additional 7. And likely there was 1 or 2 that were happened off island that were not identified by us. So I think there's definitely more than 11 that we could originate back to us. Fortunately, the New England Journal of Medicine, that just published an article, and I'll put this out for reference, the effectiveness of COVID-19 vaccines against the Delta variant. And for people that had 2 dosages of Pfizer, BioNTech, it was 88% effective against that particular variant and 94% effective against the UK variant. Very similar to what Moderna has stood up to. And Moderna was the vaccine that we had all throughout the winter. And others have received some combination of Pfizer or Moderna or Johnson & Johnson. I don't have any published data on the Johnson & Johnson. AstraZeneca was not doing very well comparatively, but that was not one that the United States had allowed under the Emergency Authorization Act. So it's clearly in our community. It's clearly starting to rise in our community. The state looks like it's exponentially taking off. We don't have any new data from the sewage sample sizes, but I think it confirmed what we suspected, is that it's in our community. And I think we're going to see a bigger and bigger rise of it over the next 3 weeks.
Thank you very much, Dr. Walker. Mr. Council, have any questions?
Yeah, Doctor, we know the source. Is contact tracing still in effect?
We haven't heard anything from the DOH about any particular site source other than individuals that are cross-pollinating to each other. You have it, what we have here off in the island, and you know kind of more than most, is that we have one person that works in one establishment, then works a second job in another establishment, and they're bringing it around to each other. But we're not being able to say there's a source problem like one establishment over another.
All right, let me highlight, or actually lowlight, one possible example that I heard of. And that is a couple of taxi drivers are unvaccinated, yet unmasked. And that's not a good thing, because you get some 20 to 50 fares a day in your cab with 1 to 15 people. Well, we can all do the math. Can we at least correct that and start working our ways out with other ones?
Certainly, I would suggest the town council consider the mask ordinance again. It's clear that we cannot tell a vaccinated versus an unvaccinated person. The Delta has an increased transmissibility. We also have some new variants coming into the playing field, like the Iota variant and the Eta variant. So we're going to have more and more of that over the next month. I think what we're going to start seeing over the next couple of months is, unfortunately, we thought COVID would be behind us, but similar to avian flu or flu, we're going to continue to see permutations of it through the next, say, 12-month cycle as well. So I think mask wearing is something to really consider. I think congregate living situations continues to be back on the radar. Some of these individuals were definitely in congregate living, and the COVID action plans that everybody had executed so well on in 2019 and 2020, I think would be something to reconsider.
Thank you, Dr. Keystone.
Just have a question. Just bear with me, Dr. while I try to ask this in a coherent way. So what we've seen over time is that these spikes seem to accelerate, right? You know, when you have still a relatively small number of Delta variant infections, what you've seen in other places is that when that sort of sees itself, it seems to accelerate pretty quickly. And I'm just wondering, sort of, when's the right time to, to make an active policy intervention, given, what you've seen on the graphs in terms of the accelerated rates of infection? You know what I mean? What I don't want to have happen is to have us be here in 10 days and the numbers are significantly worse, and wishing that we had done something, 10 days before. I hope that was coherent, but that's.
It is. I think it's a very fair question. My biggest concern from a medical standpoint is in one 7-day period, we've tripled the cases. So if we go one more iteration, we go from 42 positives to 80, and then 80 becomes 160, and we're a couple of variations away to being several hundred. And then at that point, we're behind the curve prior to being ahead of the curve, knowing that these are going to be exponential because these 42 cases have had so many touch points, and over the next 3 to 5 days, those individuals are likely going to start popping up positive.
Right. And then just one follow-up, and that is, have you seen any communities that have done a particularly good job in figuring out how to crack the nut on people getting vaccinated? You know, in other words, if this well, put it in the back of my pickup truck to drive around town with it. I mean, is there anybody who's doing a particularly good job? Because even just, you know, one extra vaccine or 10 extra vaccinated people makes a difference in a community of our size.
The communities that seem to be held out as an example are very small communities like ours that have like a deep penetrance of vaccinations into it. So we're blessed in New Shoreham to have really a good level of vaccinations for our stable year-round population, which was wonderful. I think for us, what makes us different from some of those other communities that are being held out is the variation in the size of the community between the summer and the off season. So it's been a national conversation for the last several weeks of getting those that are not vaccinated the information that they may need to push them into an action item of being vaccinated. I just am troubled by, we don't know what a vaccinated will look like versus somebody who's unvaccinated. And if they're going to spread kind of a more transmissible variant. One of the other pieces of data is that the age group from 18 to 50, they're almost equally broken out, that 14% of the cases are in each of those new groups. But people younger than that and people older than that, they're in the single digits. But there's that cohort of kind of basically 18 to 39 and then 50 to 59, mostly because of their comorbid conditions.
So what about whatever, we all know some of the congregate living sites. What about bringing a shift change vaccination clinic to those places? Does that make sense? And just say, listen, if you don't have a vaccine, you don't have to prove anything. It's just, if you want this, we are here to give it to you in the easiest possible way.
And I think we have partners with DMAT that'd be happy to do it. We still have it every Tuesdays and Thursdays. They bring a variety of vaccines. If somebody wasn't interested in doing Johnson & Johnson, they could get Moderna or Pfizer on separate particular days. It's always been known from day one that if you had Moderna, you could get Pfizer, or Pfizer, you could get Moderna. They wanted to maintain the purity of their epidemiology data to say only get Pfizer or only get Moderna. But the two vaccines that we predominantly have here on the island are standing up extremely well. I think it's just most troubling that we're starting to see an exponential rise.
It just makes you wonder that if you get even if you have 5 takers at a particular congregate living site, that wouldn't be a terrible, whatever, the more we have, the better off we are. I just wonder whether we ought to think about trying to work on that with the owners of those congregate housing locations.
That'd be accurate.
So we are doing vaccinations on Tuesdays and Thursdays, is that correct?
That's correct.
And so do we need to publicize this better? It seems that everybody should know, but summertime, that's always a problem. The other, go on the microphone. I think this was the question, Artie. The state regs on mass transit, did that ever change? They were supposed to be wearing masks of mass transportation. And I just don't know. I'm apologize.
That's my understanding. Any closed spaces with people that are unvaccinated, they need to have the mask wearing. I put a small notation that if you're fully vaccinated and you've received both of your doses in more than 2 weeks, you don't have that same recommendation. But if you're not fully vaccinated, you have to wear a mask indoors near anyone that you don't live with, and outdoors in crowded places and during activities with close contact with other people. So I would say mass transit is definitely a smart place for that.
Yeah, I think like Mark touched on the taxis, which may or may not technically qualify. The boat certainly does.
The boat regulation is that it's still required indoors. So if you're inside the boat, but outside, it's not required.
Okay, thank you.
Doctor, thank you, Martin. Sorry, to interrupt you. Doctor, who's the enforcement authority on that, on the ferry, mask ordinance?
Was that for the ferry? I'm having trouble hearing you. For the ferry?
Yes. Who's the enforcement authority on that?
I think I would, without knowing for sure, I would say likely the US Coast Guard and the Department of Health would be the enforcement agencies.
Okay, thank you very much. Any more questions from the council?
I just, really, do you know whether DMAT would be amenable to the idea of taking their show a bit on the road, perhaps to some congregate sites?
I think they'd be very open. We've had several conversations in the past month that they're willing to do anything if we would give them the support, whether it be in a different area, like we had briefly talked about Water Street, but there's a lot of reasons why that may not be a really good idea. But I think if we had a plan to give them, they'd be very open to executing it.
Just randomly, literally randomly choosing one because I don't want to pick on anybody. But if you had a clinic set up as people came out of the Overlook, for example, and said, if you want a vaccine, here we are. It just seems like if we could pick some people up, that wouldn't be a terrible thing. Well, I mean, if Steve wouldn't permit us, I guess that would be,
Yeah, there's only logistics of how well the vaccines can travel. Certainly Moderna and Johnson & Johnson can. Pfizer, certainly is a little bit more complicated, which is why the setups that we have at the fire barn's been pretty well optimized.
Thank you, Doctor. Is there any comments from the public in the room? Questions? No? Do you have anything on
You'll ask Keisha, please.
the, Keisha, is anybody on the screen from the public that has any questions for the doctor?
No one has their hand up right now.
I think that we and no one seems to be, I mean, I'm ready, no one seems to be, from Monday night until Thursday noon, there was an uptick, a noticeable uptick in masks. And then just one night, and I don't know what happened last week, people got freaked out, but, it was kind of bizarre. All of a sudden, we were back in mask wearing territory, and today it just evaporated.
Dr. Walker, are you still with us?
I can hear you. Yeah, I'm having trouble hearing a question, but I can hear you talking.
It wasn't really a question, it was more of a comment that it felt like last week people seemed to be more aware of having to wear a mask, and this week we just went back to working around.
Possibly, maybe, Andre, could you repeat that? I can hear you a bit clearer.
Martha just made a comment that between Thursday of last year, last week, that she seemed to notice a lot of the public, kind of back at wearing masks, and she just seems to think that since Thursday has kind of fallen off over the weekend.
Yeah, I think the bright sunshine probably let everybody feel less stringent about it, but masks work. There's no doubt about it.
Doctor, may I ask, I've heard individual, comments that, it's some of the communities out here, are really kind of remiss or not remiss. I'm not really interested in heading up to the fire barn to get, testing done, and businesses are buying tests and administer tests, for their own employees. I have a question, it's two-part, and I'm just wondering, how is the medical center set with tests? And can there be any outreach to provide tests to businesses that may have individuals that either don't have time or just can't get up to the fire barn?
Yeah, it's a good question. We ran out of actual tests last week. I went off island to pick some up. So we have 2 boxes here that we reserve for those that are symptomatic. DMAT has been standing ready and willing to do anybody who has and desires a test. We ran into this similarly last year, that there are maybe 2 categories. We ran into one patient who was positive here who had not been vaccinated because their employer had not wished them to have any time off in case they got sick from the vaccine. So I think employers could encourage their employees to go get tests and get vaccinated. And second one, we have a minority population that I think is still very fearful about going and getting the tests. And that is my understanding that some businesses have purchased tests from online to give to their employees. So I think we're happy and willing. It's never been there's a lack of availability of tests. It's always been just the underlying cultural concerns of why they wouldn't go get a test.
Thank you, Doctor. Anybody else?
I guess I would just ask Dr. Workup, you've seen, I've seen communities do one of 3 things. One is sort of hope that generally the message gets out that masks work. The other is a sort of strong recommendation for masks indoors. And the only one I'm aware of is at this point in our region is Provincetown, which has actually implemented a mask mandate. Do you have any thoughts about those 3 options?
I heard the first one, which is masks indoors. What were the other 2?
So one is hoping that the word gets out, basically.
Yeah.
The second is a strong recommendation for masks indoors. And the third is what Provincetown has done, which is an indoor mask mandate.
I would support, I think if our goal is to, while we're trying to figure out the exponential growth of this variant, more transmissible variant, I think all 3 of those, probably the latter 2, are the most prudent interventions. As distasteful as it may be that we're back at that point, I think it's something to consider, that masks indoors. And I think it would also help the proprietors that do want to support masks, but are not it's not something that every general individual in the public would like to do.
Good, thanks. Thank you. So Doctor, I just want to circle back. A vaccinated individual that has contracted COVID, can you just run down what they should expect to be feeling like? And is this, and go through, just so the public knows, how long they are spreading the virus. And
Yep, it's a good question. So 95% of all hospitalized new cases are those that are unvaccinated. So vaccine really gives you a tremendous conveyance of security. Only 3% of hospitalizations are those that are people who've been previously vaccinated. Other than one individual, it's been a pretty mild, if not asymptomatic case. They had maybe a bit of a prolonged upper respiratory that you would consider a mild common cold, or they thought they had allergies and they were as surprised as anyone when they tested positive. And similar to the first round, if you are testing positive, you're going to shed virus for the 10 days. And on day 11, you can re-enter your life. So if you test positive on Tuesday, we often will go back 48 hours and say your 10-day quarantine period starts then. Or if you are symptomatic and knew the day you began having symptoms, then you could reasonably start your 10 days at that point. But again, day 11, you would still test positive as you would in the first round, but you're not going to technically be contagious to anybody.
thank you, Doctor.
I just, can you hear me now?
I can hear you.
I just feel, I think, people share my frustration that we got through last summer. And it almost felt as if people forgot it was COVID because everybody had to work on everything else. but we got through last summer. And somehow we've got to get that message out that we did it last year, we did it again this year. We just got to start paying attention and focusing on what is the real problem. And the real problem is we're still in a global pandemic that everyone wants to ignore. As far as that's my opinion, but we just need to message out. I think we've got some people here who can. I think we've got some people here who can help us do that. But that just seems to be the biggest problem right now.
I'd say that'd be very accurate. I think everybody began to feel in the national data and the discussion was that the vaccine would be quite effective, and it is, but the idea of new emergence of mutations has changed some of the variables that we didn't anticipate before. And it's likely beginning the narrative that we're going to be living with this for a couple of years like we did with H1N1 until we get to that larger immunity base. But people that are unvaccinated that are contagious do pose a risk.
So we really just need to get a message crafted and get it out that this is today, this is not last year, this is not a rerun of, well, it's not a repeat. We don't want to be, I'm not good at thinking and talking. I think everybody knows what I'm trying to say here. We just need to get something that's simple, not complicated. We just can't go down there. Am I the only one who said about this?
No.
No, the words you say, I think, reflect what we're thinking.
In fact, it's worse, Martha, because there is a tool at hand that wasn't there last year.
Well, but I think that's the problem. I think everybody is lulled into this idea that, oh, we're vaccinated, and oh, we don't have to do this, and everybody, again, people act like we're out here in the middle of nowhere, nothing's ever gonna happen. It's no different from walking across the street with crosswalkers.
I'll pile on too with them, like I said. It's not that we don't have things in place. We've done a great job Tuesday and Thursday being there for testing and for vaccination. It's a head scratcher why people aren't taking advantage of it when we're literally bringing it right to them.
Thank you, Mark.
We're not alone.
7.5.
No, thank you, Dr. So, Doctor, can you compare the numbers from last summer at this time to what we're looking at now?
So if we compare that, we had 45 total known cases last summer, and we've reached a quarter of that in a 10-day to 14-day period. So we're currently at our 25% mark from what we had the entire last year.
Thank you. Any councilman, any thoughts, input?
Now,
And we're getting nothing from upstate. We're getting nothing from upstate yet.
Nothing yet. I checked the Department of Health regs right before the town council meeting. There's been new statements out of the governor's office.
I will say, just anecdotally, I went back and forth on the vote 4 times, back and forth twice. So 4 periods last week. I was unique in wearing a mask on there. At least 2 of the votes that I didn't even hear an announcement. Now, it could be that I just tuned it out, so I don't want to pick on that, but it's sort of, it has to start somewhere.
It's called Houlihan. Houlihan, but to start.
taxi owners, if you or your drivers aren't vaccinated, please get them vaccinated or masked.
Doctor, I want to circle back to the employee housing congregate living. Obviously, some of the businesses have had issues with some of their employees coming down with COVID. How has the response been with the plans from last summer, I believe? I mean, do most of them have quarantine rooms? Are they Are they exercising their COVID action plan or anything like that?
In my experience so far this year, talking with proprietors, I think they have their COVID action plans. They're dusting them off. I would encourage them to just make sure that they have quarantine rooms. I don't know if I have a good sense that they have a prepared room for quarantining, but I think because they've all been through it, they know how to shuffle it if they do have an event. I just encourage every proprietor to break out that COVID action plan. I thought they were very thoughtful last year. I think they worked well, and just be ready for when it happens to you.
Thank you, doctor. Anybody else for the doctor? Justin? Thank you. Keisha, is there anybody from the public who has any questions for the doctor at this point?
No one from the public at this time.
Thank you. Council all set with the doctor this night? Thank you. Thank you.
Okay, I'll be here if you need it.
Jessica, do you have the doctor's update?
No.
We'll get you that.
Not was put on the bulletin board or.
Yeah. But for the public knowledge, just for the tourism councils in the audience this evening. Just so that I know who I'm speaking to. All right, number 2, discuss and act on the emergency ordinance pertaining to increased COVID-19 related cases on Hot Island and methods to maintain health and safety. Obviously, with the doctor's update, this would obviously follow. What's the council's plan? So, can I comment on?
Well, I mean, I hate the idea of doing a new mask mandate ordinance. I don't like it, but I asked that question of Dr. Workup for a reason. I mean, I'm really concerned about being here at our next meeting in August, thinking if only we had done a mandate, we might have been in a different situation. When you think, I was saying before the meeting, but I read about Provincetown today that they have 550 traceable cases there. We have numbers that are much smaller, but if you listen to the way the math works, we're actually, in an odd way, not that far from it over the course of, a couple of rounds of contact because of the exponential growth in infections. So, I came in kind of thinking we would do, a strong recommendation for masks, and try to have signs and all that. And now I'm wondering whether that's sufficient. I don't know. I also think that we should figure out a way to engage with Dr. Workup and DMAT and the owners of some of these congregate living locations and make it as easy as possible for anybody who wants a vaccine to get, period. I mean, I think we've done great. That's in no way saying that we've fallen down on it, but it seems to me that, every new vaccinated person we pick up ends up serving the community well down the line. So if we have to make an extra effort to do that, I think we ought.
I appreciate that, Councilor Stover. I think we're just reflecting what's going on the national level. I think we hit that wall with people that, for some reason or not, we have made it easy. The country, the whole country is made it easy. Doc, are you still there?
I'm here.
I just have a question about the AstraZeneca vaccine. And again, in building on the stories of someone maybe coming from another country that got one shot of AstraZeneca, and when they arrived here, like you said, it's not approved for emergency use here, so they were only able to get that one dose where they came from. They came here to work. Is there any recourse? Can they get another vaccine to augment that AstraZeneca, or is that a problem? Are they where they're at?
It's not a problem at all. You do venture into some categories that they never tested, where you have the mRNA vaccine, the mRNA vaccine, which is Pfizer and Moderna. So they're interchangeable, where Johnson & Johnson's a completely different vaccine. And with Johnson & Johnson and, I'm sorry, the Pfizer and AstraZeneca actually in the New England Journal of Medicine study were kind of put up head to head. But the answer to your question, it's fairly well understood that you can interchange or restart the series, where if you felt like you had one vaccine that was inadequate, you can go ahead and get a booster with a different vaccine. They just lose the purity of which one did it the best. But the answer is yes, they could get one if they felt like the AstraZeneca is not as effective as they had hoped.
Thank you very much. Any other comments from the committee?
Yeah, we're really talking about the food service industry, aren't we, when we're talking about this problem? And granted, it's other branches, I understand that. But a huge part of it involves the food service industry. And if we were to make a face covering mandate, everyone's in these restaurants and such, and they're basically eating or drinking where they don't wear their mask. How difficult is it for us to actually enforce something like that?
Well, I think I wouldn't necessarily put it to the food service industry, other than it tends to be of the kind of youthful generations that tend to work in that industry. So I think it's that age group that tends to not necessarily have a high penetrance of vaccinations. So it's reaching out to the individuals that are either distrustful of getting it or feel the sense of invincibility of needing it.
So we're talking about the workforce as opposed to the customer base.
Say that one more time.
Talking about the workforce more so than the customer base.
I am. Yeah, I think the workforce, they're forward facing to hundreds, if not thousands of people per day. And that puts them at tremendous risk. And if unfortunately they were to contract, they are also seeing the same hundreds or thousands of people to just kind of bounce it back and forth. I first and foremost want them to be safe, but I do think they're going to be exposed to people that have chosen not to be vaccinated, and there's no way to tell whom that is. So I think getting safe and protected is the only thing we can really do. So wearing masks and getting yourself vaccinated.
So we have that written down the last part of the statement you gave us, Dr. Warren. The masking requirements, if you're not fully vaccinated, close contact, you're fully vaccinated, that's a simple enough blurb. And I think what we just heard is that the whole business about, and I know this is the fault, everybody automatically goes to is where you're eating in a restaurant, except of course the servers are eating, and the other ones that seem to be more vulnerable or be more likely to be carriers. Or I mean, I don't know. Are waiters and servers wearing masks? I don't know. Maybe somebody could tell me.
I think it would certainly be helpful if it was more universal. We are blessed to have a lot of outdoor venues, which does convey a lot of protection. I think we'd have to be very specifically concerned for venues that are indoors with not a lot of ventilation, which means that they can't manage the social gathering mandates by the DOH of being properly spaced and away from people that are unvaccinated. There's just no way to do that in confined or more confined spaces.
That's pretty simple. You just have your servers be masked, your kitchen help be masked if possible, and it sets a standard. It's an example.
Thank you. Doctor, is there an inconsistency? I think it's, with on that topic. You have in restaurants, the servers are wearing masks, and then you have nightclubs where everyone's packed in there. I think you just kind of touched on that. Where, like you said, it's not good ventilation, but no one's wearing a mask. Is there any inconsistencies there, with the governor's sort of recommendations on mandates, or?
I think there is a discrepancy. It's clearly on the DOH website of if you're not fully vaccinated, and also separately, there's the social gathering and distancing policy. There's no way for that policy to be met in an indoor nightclub venue. So I think there's a discrepancy between the recommendations and the actuality of certain indoor venues.
Okay, could you, sort of put that in your mind and maybe, help us with a way, if it really starts going south here, that we can take action on that and fix that if needed?
Will do.
Anybody? Public? Keisha, is anyone in the public that has any comments?
No, no one from the public.
Council?
That's discouraging.
They're listening.
Are they listening?
How many we have on?
How many?
You can't tell how many people are watching.
Mr. Hester? You have anyone here?
Yeah,
Please, yeah.
I don't know. Medical patients.
Stephen Hester. I don't mean this to sound rude in any kind of way. I know that you all are not idiots. But if you're trying to stop a pandemic and this type of thing, you're not going to be able to have bars. You're not going to be able to sit in restaurants without masks. You're not going to be able to ride in taxi cabs without masks. It's really very simple. So that's either what you do or don't do. You know what I mean? Like trying to think of what are ways we can do. There is a way, that's what you do. And that's not what you want to do. That's fine. You're more, you know, we're a tourist trap. If we don't do these things, we don't get to be a tourist trap. But I mean, it's, you know, it's not as complicated as we make it.
Thank you, Steve.
That's why Andre's point of having something ready to go if this trend sadly continues.
I don't see any reason it's not going to continue. There's no data, nothing that's happened in the last year plus could lead us to logically conclude that this is anything but something that's going to accelerate. And that's why I hate to say it, but I think we should amend our underlying emergency ordinance to mandate masks indoors.
Thank you, Keith. Is that emergency ordinance ready? Or does it need some more?
So I think you need that second roll on.
Oh, the councilor's here.
So I understand. Address some of those questions.
Okay. No, I didn't know she was the one. Thank you. Catherine Rowe, are you with us? Can you hear us?
I am here. And I just want to remind everyone that under the charter, if you decide to enact an emergency ordinance tonight, this afternoon, whatever, the first order of business has got to be a vote by the council to suspend section 409A of the charter, which is the normal way to enact an ordinance. If the council votes to suspend, the council can proceed to enact the emergency ordinance. However, the vote to suspend under the charter has to be unanimous.
Thank you very much for that information, Catherine.
And I also do believe that the emergency ordinances have all expired. So you can try to revise some of them, or you can just start with a new clean one, if that's what the council decides to do.
What's your recommendation?
I think it would make sense that rather than trying to go back, because we had we've started this back, I think it was February of 2020, and certain things were amended, certain things were added. So rather than try to reinvent the wheel and figure out where we are with an emergency ordinance, I think it would make sense to just do another one.
Thank you very much, Counselor, much appreciated.
And just for consensus, would it only be for vaccinated, unvaccinated people, or everyone indoors?
I think it's everyone indoors. When you listen to the thing about the fact that even if you're vaccinated, you're still shedding active virus, I think it's got to be everyone. I also think it makes it easier. I mean, I'm not looking for police officers to be giving people tickets for not wearing masks, but even if we, it's sort of like the vaccines, if we pick up the 30% of people, responsible people wearing masks, then we maybe bend the curve a little bit,
Well,
Do we need to have an ordinance before us? I don't have anything with me, and those all expired, and those are all based on executive orders that have been issued by the state.
Yes, you can instruct me to draft something and you can adopt it in 48 hours.
How does that give you time really to notice a meeting? Yeah. Yeah, I would ask, I would agree that we should ask Kathy to draft. I don't know if we need a motion, but ask Kathy to draft. We do.
I'll make
Kathy said something about suspended 409A.
Yeah, I wasn't sure whether we were just giving Kathy direction and then when we came back on Wednesday, we would suspend. Whatever we can.
On Wednesday. So, another thing about meeting in person is starting to track, if we need to have a location. So, just bear with me for a minute.
Maybe have a meeting.
Yeah.
So can we get through it? Find out what time the meeting is?
They usually meet at 6.
Can we really, we need a location?
Yeah.
I need the location.
I just want to say, coming from the thick of it, I just want to say, coming from Mark and I were, last year at this time in the thick of this. We learned a lot. We're here, we're not then. I couldn't believe that the masks are a personal choice. But I also realized that when that cases are going up, it doesn't drop off. It keeps going. It keeps going up over time. And I agree with Councilor Stover that this isn't going to be better next week. I reluctantly will support a mask ordinance, but
I feel the same way.
I'm pretty we're here. I didn't come into this meeting supporting mask ordinance. There's a strong recommendation, people inside, wear masks, put the word out there, but it's not going to do it.
You and I are in exactly, I think all four of us are in the same. I mean, I came in thinking, is there a way we could put a billboard at fair saying, we have positive cases, here's where you're next, or, something like that. But I'm just not sure that it's going to be.
I don't want this to be an idea for the police.
No.
We'll get there on Wednesday.
So do we need a motion to ask Kathy to draft, or what's your pleasure?
Maybe we don't. Kathy, we can just tell you that.
Since we are, by instructing me, we are suspending the charter, I would just feel happier if we did the motion tonight and then when you actually adopt it.
To suspend Kathy or to switch?
Yeah.
Oh, wait, no, I'm sorry. There is somebody from the public, from when you're over, going to, when you're ready to take public comment.
Thank you very much. Let's get an answer to what
Yeah.
we heard.
We need to suspend 409A, Kathy?
Actually, it's suspending 409A, correct. The motion would be in order to suspend Charter Provision 409A for purposes of an emergency ordinance to deal with a situation involving the public health, safety, and/or general welfare of the town or the persons in the town.
Understood.
I make that motion.
Is there a second?
I'll second.
Second by Councilor Manuel. All those in favor, Keith?
Yes.
Oh, second, all right, so the motion is second. Public comment, I'm sorry, this is all new to me, because I don't have a screen in front of me. So, Mr. McComb, if you have a comment? No, go ahead.
Hi, Andre, can you hear me?
I can, we all can, please call.
Yeah, I apologize. Like Dr. Walkoff said before, we can't really hear anything the council's saying. It's muffled, and I apologize for not being there. Unfortunately, the meeting being at 5, I wasn't able to go to work early enough. But what I think my hearing is you're contemplating about the ordinance about masks. And I would just like to say, I think that any ordinance that you put, you should not put any ordinance that you don't intend to enforce in. I think it's a good idea, educational. I think it's a good idea for the council to take a position on it. But I think what happens is it creates confusion. I think we should maintain the same level. There should be one statement that, you know, with the Department of Health and that comes out. I think what happens is it creates confusion. Last time what happened is we have, you know, even though it was something that was an expectation, it wouldn't be enforced. The toothless ordinance, I think, creates more of a problem, not only for the police department expectation of what is going to be enforced and not enforced. So I think you're going to get a good hard look. I think we'll get a lot farther with education and asking and taking a statement of position. So, and like I said, I apologize because, you know, I think most people on the Zoom, we're only hearing every third word. Unfortunately, it's not coming through clear. So, anyways, thank you for your time.
Thank you, Mr. McComb. And for the record, and for the public's knowledge, Bill McComb is our co-EMA director as well as the security officer for Interstate. Is that correct?
That's correct.
Keystone?
I just am curious, Bill, does the Coast Guard still have a face covering mandate for ferries?
Yes, indoors, but they're not enforcing it.
So you're not enforcing it either?
No. We make an announcement. We educate people of what the law is, that masks will be worn indoors. The Coast Guard has asked us to call the local police if there are any violations. Exactly.
I'm sorry, Bill, could you repeat that, Chamber?
So the Coast Guard, there was a federal mandate about where masks were to be worn inside, not outside on ferry vessels. If there are any violations of that, you know, we make announcements. If there are people not complying, they ask the ferry operators to turn to the local police.
So that's basically saying the Coast Guard's not running the ferry check. It's all right. They're probably not running the side of what they do. I've seen it.
I'm sorry, Andre. Could you, or Kathy, did you hear that? If you could repeat it, because it seems like anyone on a phone comes through clear, but the council isn't coming clear to anyone's phones.
Well, I was on the ferry this last week, 2 round trips, and the compliance was about virtually 0.
I don't disagree with you.
Thank you, Bill. Thank you, Chief. We have the marching orders for Kathy. Yeah, this isn't final tonight, Bill. This is
But don't, Andre, can I say something? I think the problem is that what's coming up, there's a lot of confusion on this too. I think that, you know, what you heard Dr. Fauci today say that if you are vaccinated, you don't need a mask indoors. I mean, so the problem is we're giving mixed messages all the way across the line. I think that we need to have a unified, you know, there needs to be a unified stance. that's coming from government, all agencies, whether it be our local agents, state and federal. And that's not happening. It's creating confusion and frustration with people. When you have, whether it be a ferry, a train, or a restaurant, or whatever it might be, there's such a mixed message. I was at the Registry of Motor Vehicles today. I opted to wear a mask just because that was my choice. But half the employees had them, half didn't. I'd say 25% of the people had masks on that were inside, and the others didn't. You're getting the message from, from a federal level that.
Hey, Bill, it's Keith. I'm not so much confused about confusion and frustration. I'm concerned about infection. And to the extent that we can get more people to wear masks with an ordinance, I think as a population we're well served. You did a fabulous job all winter getting this community to where it was. You and Dr. Warkup and the previous council, I think, did an extraordinary job. But we're basically headed right back to where we were. And I think just sort of hoping and worrying about whether people are confused is not going to come in 3 weeks when we're overrun with this Delta variant. I just disagree with where you're coming.
Well, I think you might want to go back and look at your history with our police department about 6 months ago when you were all over the chief in the department because they weren't enforcing to the level of the mask. So I think my point being is you need to not have a toothless ordinance. If you have an ordinance, you need to be able to look at, is it going to be able to enforce? And are you going to get farther by education, or you're going to get farther by an ordinance that you may not be able to, ordinance that you might not be able to enforce from a fine point? I agree with you. I think the mask is a good idea. I have no problem with it. But I think what we did is for us to make an ordinance that goes up and above, and we have no way to implement it, you're going to create a lot of frustration and aggravation with people. For those that people think you should have it. I mean, we had it down at the dock. We had civilians down there that were chastising people walking off the ferry. And then, there's the question is, are you going to be able to enforce this? And if you're not, I don't think you should pass a toothless ordinance. That's all.
Thank you, Bill.
I'm sure we'll get more people in this room on Wednesday.
Yeah, good.
That's fine.
I'm sorry, can you repeat that, Mark?
I think we'll get many more people in this room and on Zoom on Wednesday.
Just for the record, from an EMA standpoint, I'm not against mask wearing. I'm all for it. I have no problem with that whatsoever. But but I do think that we will get farther with education and by the council taking a stance and a position than we're going to get with just putting out an ordinance that we realistically, wink, wink, nod, nod, know that it's not going to be really enforced. And then it's going to put a burden on who? Is it the police department? Is it, I think we have the same position. I think we want to encourage masks when to get there. But I got to think about the way we do it. I don't think people are saying, oh, because it's the ordinance, I'm going to wear it. I think the compliance is going to be when we can present to people that it logically makes sense and there's a reason for you to do this, not because we're just mandating you to do it. And I think that can be done I think Dr. Wolkoff does an excellent job. And I think between education and the council taking a position, and I don't mean from a fine posture, a position and backing that, I think we can get there. That's all.
Thank you, Bill.
Thank you.
And like I said, last year we were here, we were reactive. And I think from what I'm hearing from the doctor tonight, I think our minds have changed in this room within the past half hour. And I don't want to react. I want to throw out a message out there that we're serious. Block Island is not safer than any place else on the mainland. Everybody saw it last year. So we want to send a message that it's not safer here any more than it is anywhere else. So I think we're doing it. We're not making a decision. We're not voting on that. There'll be discussion on this on Wednesday.
I think what we should do is because the zoning folks are meeting tomorrow, Wednesday at 7, if it's possible, exit. So if it's possible, have this meeting on Thursday. That'll be 24 hours.
Okay.
Thursday. Okay, and so we will be meeting again right now, Thursday. So further this discussion, and consult with our police chief on it, because I don't think that, I think we need to consult our enforcement authority on this. We need his input, and we'll make decisions on Thursday, but this is just getting ready. To send a message to the public that we're serious, and this, as Martha said, this is a global pandemic, and we're still in it. And I think we're doing what we can,
Very well said.
and we're gonna do it.
For this.
Thank you.
Thursday, Saturday.
Thursday, yeah.
But I do think immediately, as we all sit here, I think we're all vaccinated. But, if we can just get all the police wearing them. I mean, that's gonna be tough, but that sends a message. That is a more visible, message than something that's written somewhere that somebody might read. I mean, what is our objective? Is our objective having no grand laws, or the objective actual accomplishments? And that visual, and I think the police have been very effective so far with some being there, being visible, and the other face of our town right now.
Thank you, Martha. Also, it's, I think what we're talking about is masks.
I know what we're talking about. I'm talking about immediate reaction before the experience day, if that's something we're willing to have a conversation about.
Mary, in terms of events this evening, I think we have to consider what we're gonna do with you. If we're inside, public facing, just an opinion, your thoughts on that, on Thursday?
We can, yeah, I mean, we can continue with the Zoom. But you're not, the council must be in person. The council must be in person.
Thank you. Okay, we have marching orders for us to listen to. We had a motion on the table. Yeah, I have to call on that. There are other, would you want to handle the meeting with the chamber, craft a letter? You want to handle that this evening?
What I'll do with the chamber, I need to reach out to law and find out, work with laws and maybe also with the tourism council, find out which businesses have employees that haven't been there. If there's a way to corral that, you know, DMAC phones have both, the Wolf Pup phones have both, I don't know, or we don't know who is. And if we can do that, and set a specific time for that, and a specific place, we'll be more than happy to do that. But we don't know who those folks are, and I really need to work with the chamber on that.
I'll make a motion to request the town manager work with the Chamber of Commerce and.
So I've got a motion on the table.
Well, sorry, do you know?
It's been
Okay. Motions are made and seconded. All those in favor, Martha? Mark?
Aye.
Keith? Yes. I'm in favor. The motion will carry 4-0. I'd like to make another motion to request the town manager, Mary Ann Crawford, work with the Chamber of Commerce and the Tourism Council, to work to find out where the congregate and where the congregate and employee housing is, and to ask the business to reach out to these folks, and to ask the business to formalize a COVID action plan.
Second.
Seconded by Mark. All those, any discussion? Any discussion from the public? Any comments from the public? Keisha?
Does the development of the COVID action plan include asking whether, if they think it would work, some sort of a mobile vaccination clinic that goes to these locations?
I don't need a motion.
You don't need that, right? Thank you.
The purpose of this motion is to reach the businesses,
Right.
you know, and just remind the businesses, the dust off plan, town manager reach out. Because they did have plans and they were effective, I think. I think we need to take a little bit more authority on that and, have the town manager reach out, because, again, statewide, last year at this time, there was major outreach, from major densely populated areas, and that's no different here. So if we could just get that, Mary to reach out, that, hopefully that'll work out. Motion made, seconded, all those in favor, Martha? Mark?
Aye.
Keith? I'm in favor, motion will carry 4-0. I'll make a motion, not only a motion for this, Mary, could you please reach out and find out, I guess, the enforcement about the ferry, about mass transportation, where, like, who, Bill says that it's the Coast Guard's telling the local authority to do it. Who's the other authority? Is it the local police, or is it the Coast Guard? Is it the Department of Health? And in the same breath, would you mind trying to also get facts on our taxi drivers and who the authority is on that? Are they covered under mass transportation? Because we have our own taxi ordinances here. Just trying to figure out, the authority that we need to deal with. I mean, is it just the letter of the taxi commission? Is there anything else? But
That's a good
If
start.
we're going under emergency,
I just, well, in preparation for Thursday, there's some things we need to know.
well,
Well, you lived through it, no.
the state unfortunately is not
No, we,
in the strong position. That's part of the problem.
I know. And there's many reasons for that, that I will not get into this evening here. Is there any other directive for the town manager in preparation for Thursday that the council would like to discuss? Lars Johnson might even be here because he's not on the agenda. Keisha, is Lars Johnson on the call, on the chamber?
Let me check. I'm not seeing his name here. Just a
I
It was.
Okay, thank you very much, Keisha. Appreciate you checking. Are we through with,
As long as people,
how does Lars get in? He walks through the front door.
he's on the boat.
How about we just make a motion to receive his request?
The attachment tone is issues.
He has requested. Is that the walk-off service? We are under.
No, I just want to make sure number 2 is wrapped up. Thank you. Number 3 on our agenda is receive an act on request for town sponsorship for 2021 Blues on the Beach concerts. This is a request that came to us from the director of the Chamber of Commerce. Does anybody have a hand? Hold on, let me hop. I'm just gonna read it. Well, anyway, the Chamber of Commerce at the last minute has been able to organize Blues on the Beach, July 28th, August 11th, and August 25th. They are asking for town sponsorship for this event, and that's the item on the agenda. Like these 3 events, actually. Any comments? Council have any comments on this? Questions, concerns?
I'm totally in favor of it. Popular series, outdoors. I had an hour and 10-minute discussion, so I am in favor of going forward with this.
And I did get a text from Lars. Please say that I requested Dr. Walcott to weigh in on the concert. I was just thinking about it, but he seems to be gone.
Keisha, is Dr. Walkup still online with us?
Dr. Workup is still online, and I do have Lars online as well.
Great.
And Dr. Walker. Dr. Walker?
I'm here.
Thank you, Dr. Walker. Outside event, Blues on the Beach.
I'd have no reservations. I think outside conveyance and safety is quite good. I think as long as we have proper space for the amount of people that may attend the venue, I think it's very similar to the ongoing movies on the beach. When I've personally gone, I think it's been a great experience and well attended as well as very safe. So I'd have no personal reservations.
Thank you very much, Doctor. I feel the same way. I feel as though it was on the beach, we haven't had it in 2 years. So we brought out a very, abundant local crowd. Everybody seems fun at it. I don't see a problem with an outside event like that on the beach, especially if it's 12, 10, 15. I'll make a motion to the town of New Storm to sponsor the Blues on the Beach. Blues on the Beach concert events for July 28th, August 11th, and August 25th at the Town Beach Pavilion, pending receipt of a tour policy holding the town as an additional insured.
Second.
Motion made second by Mark. Is there any comments from the council? You got your comments. Any council from the public at large? Keisha, any comments from the public online?
No comments from the public, but I do have Lars here if you need him.
Laura Strasser. We are.
Hello, everybody.
Hi, Laura.
Thank you, Dr. Workup. Hi, thank you, Dr. Workup. Appreciate that very much.
Thank you, Lars. Motion made second. All those in favor? Martha? Keith? Yes, sir. Mark? Aye. None in favor. Motion carried 4-0. The Blues on the Beach, and I'll make a motion to adjourn.
Second.
Second by Mark. All those in favor? Martha? Keith? Yes. And Martha. Okay, this meeting is adjourned, and we will revisit the emergency ordinance on Thursday night at 7 p.m. Thank you, everybody, for coming into the room. Thank you, everybody, for coming and joining the line and listening on the YouTube channel.
Or that one meeting. Totally different direction. I think that's why you have meetings, right?